Welcome to the Functional Medicine Foundation's podcast, where we explore root cause medicine, engage in conversation with functional and integrative medicine experts, and build community with like-minded health seekers. I'm your host, Amber Warren. Let's dig deeper. Okay. Welcome back, everybody. We're here tonight with Dr. Mark Holthouse to discuss all things male hormones and male hormone optimization, because we really haven't dedicated a podcast to this yet, which is kind of shocking.
Are you serious?
Yeah. So Here we go. Okay. Dr. Mark Holthouse is the Chief Medical Officer for FMI Center for Optimal Health and Functional Medicine of Idaho. He graduated from Loma Linda School of Medicine and went on to obtain his family practice training at UC Davis Medical Center while in the Air Force Scholarship Program at David Grant Medical Center, Travis AFB. Dr. H has over 32 years of family practice experience and brings years of practice in the areas of functional and integrative medicine. As part of the Institute for Functional Medicine teaching faculty, he has educated thousands of practitioners in hormone health across the nation over the past decade. As an assistant professor of medicine on the teaching faculty at Loma Linda University School of Medicine, he is an expert on cardiometabolic disease prevention, reversing type 2 diabetes, heart disease, high cholesterol, obesity, and metabolic syndrome. In addition to his clinical and teaching experience, he has 30 years of owning his own private practice as acting medical director, implementing strategic models in clinical practice and in the business of functional medicine. Dr. Holthouse and his lovely wife, Tammy, enjoy photography, snowshoeing, skiing, sailing, hiking, kayaking, and of course, great food.
I think you almost have that memorized.
I don't know why I still need to reference anything, because I for sure have that memorized.
Yeah.
I for sure know all of your hobbies and habits. And I feel like I could actually add
a
much bigger list to what you enjoy doing. Yeah. So this is so
Thanks,
awesome.
Amber.
So yeah, no, welcome back. We're so excited to have you. So I think this is 80% of the medicine we're doing, right? Men's hormone health and how it relates to cardiometabolic health in our nation. And it's such a big deal. So let's just dive right in and say, okay, men, testosterone levels, why do we care? How important is it, and why is it so important?
You know, I'll start with just some ground rules, kind of the taxonomy. Mm-hmm. So many people go to their doc and they get a total testosterone, and they say it looks great. Don't worry about it. It's within the normal range. I think the big thing to realize is that there's optimizing testosterone where you feel good. Mm-hmm. And then there's getting your insurance to cover your prescription because you've met a criteria where you're below a certain cutoff point. We know from experts in this field, Abraham Montgeller, the urologist from Harvard, and 9 other countries put together a thesis of 9 statements back in Mayo Clinic Proceedings 2016 that said, hey, a lot of guys, this is a real problem with quality of life. Mm-hmm. And regardless of knowing what the cause is and regardless of the reference range, a lot of people do better when you replace or give them a therapeutic trial. Mm-hmm. So we have really kind of fashioned our practice here around optimization, not just treating people with testosterone deficiency, which is what's recognized by traditional practices, and endocrinology is really the only thing to treat. And so I'm following more what the studies are showing, that the reference range is fairly irrelevant. Assuming they're a good candidate, there's no contraindications, and it's safe. Right. I'm also a big believer, though, if they don't respond, they don't feel better for the reasons you started them on it in 6 to 12 months, you probably shouldn't continue. Yeah. You know, it's not necessarily worth the time and money. And there's so many ways to do testosterone, which we can talk about if you like.
Well, and I like that you hit on, what the conventional quote unquote insurance, how they approach testosterone deficiency, right? It's also, and I think it's still this way. It's been so long since I've practiced in the insurance model, but you need two random blood draws, right? Yes. It's almost like they don't believe you if you get one. Like, oh, he's not actually low. That was a mistake, right? Let's prove it again and have to spend another $300 to get another draw, which always just seems so silly to me.
It does vary. If you have an off day, you're not supposed to check it if you're
later in the day,
or later in the day is very different than in the morning, especially with younger guys. Older guys, it's a little more consistent, but it can vary 20 to 50% between the morning and afternoon in guys under age 40. Yeah. But it's an expensive kind of lifetime commitment for them.
Absolutely.
So I think
they want to be sure.
Throwing up another hurdle, why not?
That's true.
To care.
So how does testosterone, DHEA and estrogen. We know, we talked about it on our female podcast. Testosterone is really important in a woman's body. So how do those three hormones play a role in a man's body?
First, a great question. Thank you for asking. The first thing I want to go on record saying is testosterone's not a male hormone and estrogen's not a female hormone. We have different ratios of the two depending on the two different genders, but the most abundant sex steroid in a female body is testosterone. And all estrogen comes from testosterone. It doesn't go back the other way from estrogen backwards. There is uniqueness in the roles that each of them play. You could say DHEA, which is that androgen male hormone precursor from the adrenal gland, which basically leads to testosterone, which leads to estrogen. They're all important. They all have different receptors. They all have unique roles in the body. DHEA has its own mortality risk if it's low for cardiovascular and all-cause mortality, independent of testosterone. It works, especially in women that have cognitive issues, along with sometimes pregnenolone. It seems like better than in men, in my experience. That's what I've seen.
So pairing DHEA and pregnenolone.
Yeah, you can actually just do one or the other.
Okay, I thought you said using both.
You can use one or the other. Yeah, and I've seen people do both. I'm not sure I personally see the utility in that.
Yeah, I agree.
But these precursors, some providers feel have advantages over giving you the actual downstream.
But you don't know where it's going. You don't know exactly what direction it's going.
Right.
So that's hard.
Exactly. And so there's this whole thing of giving 7-keto DHEA, but that it somehow doesn't get aromatized. But there's really a positive data to support that.
Okay.
So if they're low or suboptimal on DHEA, I'll sometimes supplement them with that as an oral or sublingual individually. Or if they've got ongoing brain fog, once estrogen, testosterone are optimal, they've got normal thyroid, cortisol's not crazy, making them so they can't concentrate. I can certainly look at pregnenolone and DHEA.
Okay. How about DHT?
DHT is just like another metabolite downstream of testosterone, right? It has a decision. It can either go to estrogen or it can go to DHT.
Right.
So only about 10% of circulating testosterone exists in the form of DHT because it's so dang powerful.
Right.
It's what causes enlargement of the prostate, thinning of the male hair, scalp, and on women too, and acne if you get too much. So that can happen from just having too much 5-alpha reductase activity. A lot of these guys that are using topical testo cream on the scrotum, for example, tons of 5-alpha reductase enzyme there. So most of it's going to convert to DHT. These guys get DHTs in the 300s. And the problem with that is that they can get acne, they can get hair thinning, and they can have problems with urinary prostate enlargement and slow urine flow, things like that. Estradiol is as important as testosterone, I think, in men as testosterone is because of its role in preventing bone loss. So many of these guys come to me on testosterone or want to be on testo, and their buddies are all on anastrozole, which is an aromatase inhibitor to block the T from becoming estrogen. And I want my guys to have an adequate amount of estradiol because it not only helps with preventing osteoporosis, but in many of the studies, we think that testosterone's benefits to the brain, to pain management, to cardiovascular health is mediated through estradiol.
So interesting.
The guys we got to be careful with are the guys that have a lot of central obesity. They've got a lot of aromatase present. And they will make a lot of estrone when you give them testosterone. And these are the guys that will get the growth, the breast growth and the gynecomastia. Those are the ones you have to be careful of on the dosing initially until you fix their metabolic dysfunction and their obesity there.
Because we know those things stimulate that enzyme that then converts into estrogen, or the aromatase that you mentioned.
Yeah, the things that upregulate that aromatase enzyme are insulin, inflammation, cortisol, stress, obesity, low zinc, some of the endocrine disrupting chemicals that we look
So it's
for.
so much more than just taking tea.
Yeah.
So much more that plays into it.
It is a not to be seen as a silo. What I love about hormone health is that it is so intimately connected with insulin and cortisol and glucagon and ghrelin and incretins and
gut health, liver
leptin,
health.
liver health, fatty liver. They're all part of the same story.
Yeah.
We now know that guys that have low testosterone have a higher risk of fatty liver,
Right.
who have a much higher risk of heart attacks, diabetics with fatty livers, metabolic dysfunction, much
Guess
higher
what, guys?
risk.
It's all related.
Yeah.
It is really all related. Back to your comment about the guys that are applying the transdermal cream like to their scrotums and the 5-alpha reductase. What would your argument be if someone said, well, then I'm just going to get on a 5-alpha reductase inhibitor?
And they can certainly do that.
Yeah, okay.
Yeah. My advice would be, if you're dead set against pellets, dead set against, a gel, so just topically anywhere on the skin, or a cream that's compounded, and you like the effects you're getting there, then let's put you on.
Just do the inhibitor.
Finasteride.
Okay.
Yeah.
Okay.
Usually Propecia, which is the 1 milligram dose. And I usually do half to 1 pill twice a week, because if you drop that DHT too abruptly, that is a really powerful androgen receptor ligand that binds to that receptor and gives you the effects of the T. So I've seen guys with high DHTs take too much finasteride, and they're like, hey, my pellet doesn't work anymore. My injection's not working. Now you're on too much blocker.
Yeah, here's why. Yeah. Okay, that makes so much sense. So we talk a lot about sex hormones as it relates to just talking about hormones, but I think we forget that there's other hormones. You mentioned one, our stress hormone, cortisol, that play an intricate role in just how hormones how they function or metabolized in the body. Thyroid health. I'm not sure, and I know because statistically more women are going to have, Hashimoto's, autoimmune hypothyroid disease, but I'm not sure that I think that there's enough attention given to thyroid health in the male population as it relates to hormones. Do you agree?
I do.
Disagree? Okay.
I do.
So why is thyroid health so important amongst this conversation?
Well, when it comes to secondary low T, where it's coming from the message from the brain not quite being right, telling the testicles to make T, one of the causes can be hypothyroidism, low T. Okay. So it's a direct cause of low T in some guys.
Yeah.
I think more importantly, though, its effect on the liver and its production of something called sex hormone binding globulin. We know that hyperthyroidism is associated with excess of this protein. Right. And if you have more SHBG around, it binds up your testo, making it virtually inactive. So you have less free hormone to do its thing. So when you've got a hyperthyroid situation, that's important. Hypothyroid is going to do just the opposite. It's going to lower SHBG. You're going to have more free testosterone available. Now, on the men's side of thing, that's maybe a good thing. But when you're dealing with a woman with PCOS, who's already got estrogen dominance, you don't necessarily want lower levels of SHBG to have more free estrogen running around, creating more havoc with their messed up menstrual cycle.
So that's the link between, I just always find this so fascinating. SHBG is such a fascinating protein to me, but that's the link between hypothyroidism and breast cancer, right? If it's estrogen driven, correct? Because you've got too much free estrogen doing their dance and, rummaging around the body and wreaking havoc.
Yeah.
Okay.
Yeah. And if you've got insulin, pre-diabetes or type 2 diabetes running around, insulin upregulates aromatase, makes more of the estrogen. You add a little bit of central obesity, more aromatase. Yeah, so it's just this vicious feed-forward cycle. But insulin, being a pro-growth hormone, is very pro-cancer in excess. We need it to live, but too much. It's so true with so many things. Oxygen, testosterone.
It is
thyroid.
so true.
Insulin.
Fine symphony, the Goldilocks theory, right?
Yeah.
Which is why we test levels and we start low and go slow, and you have to check levels after too. But I think I wanted to hound on that topic as well, because I think there's so many men especially you guys are so targeted and you just want to feel better and you want instantaneous results, that might do what we call point of care testing, right? You get an instant lab back that's just total testosterone and nothing else, right? And it doesn't tell the whole story.
Yeah.
And so I just would encourage men to seek out somebody who will run that full panel on you to really get the whole picture and therefore the whole understanding of what's going on with your system.
You bring up a good point, because if all you're looking at is total T,
Yeah.
we were talking before we came out here how so many guys that you start on testosterone therapy, your total T goes up like crazy, and their free T sometimes doesn't budge. And there are these botanicals that you can sometimes add that will, for whatever reason, I don't think anybody knows, sometimes they're able to liberate. And maybe it's working through SHBG. Maybe it's working through other liver proteins. I don't know.
Right.
But just like with, selective estrogen receptor things in women, cohosh and many of the things that we use botanically, Vitex, hops, red clover, rhubarb, that are probably working through these other mechanisms that have hormone-like effects that adaptogenically kind of help with the hypothalamic pituitary gonadal axis without being a hormone per se. So there are other things you can do besides the testosterone that can help support.
But are those going to get you optimal? If we're truly looking at these optimal reference ranges, okay.
This is going to be for people that are kind of, mid-normal range that are looking to get a little bit of a pop, that can try, or they're just opposed to or contraindicated. They can't do it,
right?
They've got breast cancer, they've got prostate cancer. That's not stable. And they can't really, or an active clot.
Can't go feed that. Yeah. So what's the average age where we start to see T levels really start to decline in our guys?
Let's see. So in guys, it starts to go down by about 0.5% to about 1.5% per year after age 25. Women, it's highly variable. Most of it's coming. I know. I can't resist. I got to talk.
You always have to talk about. We already did that interview, Dr. Holthouse.
Opportunity. Women. I mean, there are women in their mid 30s that start losing testosterone more rapidly. We know there's a sudden drop at menopause because a lot of it's ovarian. But the ovaries continue to make a little bit of testosterone for the rest of their lives as long as they've got ovaries. There's a little bit made, obviously, by the adrenal as well. Guys, we're pretty much a progressive slide. We don't have that sudden drop in T, progesterone and estrogen at 52. So I mean, it's fairly common to see, depending on the way you define low testosterone, what parameters you use, it can be as high as 30% by age 40 that have low levels.
And what are the most common reasons to start having your testosterone drop earlier than others, right?
Some of the most common reasons are obesity. That's probably number one.
For some of the reasons you already listed, right? Aromatizing.
It's all about that. There is a direct relationship, it appears, between obesity and your ability to make your brain send signals to the gonads to make T. And as you lose weight, it's restored.
So with that, sorry, I know I interrupted you because I know you're going to keep going, but is that an argument for the use of GLP-1s?
Absolutely.
Yeah, I figured
Absolutely.
It would be. Yeah.
Yeah. I mean, there's data, there are studies now that are hinting at the idea, more than just hinting, I would say there's a very valid hypothesis now that needs more randomized clinical trials to validate cause and effect that would suggest therapeutically using testosterone to help reverse type 2 diabetes and prediabetes. Large trial, January 21, Australia, 2-year trial, gel versus placebo, couple hundred guys. And they had newly diagnosed type 2 diabetes or they were pre-diabetes. And at the end of the 2 years, both had same lifestyle interventions. The group that had testosterone over placebo had a significantly less of a incidence of type 2 diabetes and prediabetes compared to the controls who got no T.
That were not.
Yeah, they were both given, dietary.
I was going to say, I'm sure the
exercise.
lifestyle modifications were probably pretty significant.
Same program. So it was just the T, and they were stratified very well to look at other conditions.
Wow.
That were confounders. So we're seeing testosterone moving from treating just sexual symptoms, preventing bone loss, now to, whoa, this might have something to do with helping reverse fatty liver, helping reverse type 2 diabetes, prediabetes, metabolic syndrome. And that's where it gets exciting because it's involved with that. And GLP-1s, having that same effect of not just weight loss, now we're looking at, potentially helping dementia, AFib, cardiovascular protection, in addition to taking the food noise away, the neurotransmitter benefits, the addictive dopaminergic hit we get from food. It takes a lot of that away, kind of like our smoking cessation meds do, to give people a chance with some of these really hard to get rid of habits.
Yeah. GLP-1, sorry guys, the GLP-1s we're talking about are these weight loss peptides. Ozempic, Wegovy, some of the compounded tirzepatide that we use at lower doses than microdose here. Yeah.
The stuff all your neighbors are on.
Yeah, exactly. Exactly. Yeah. And that's a whole nother topic on how to use and prescribe those appropriately. But yeah, lots of really interesting data coming out on the GLP-1s when they're used appropriately. Are you looking for high-quality supplements? FunMedShop.com is carefully curated by the wellness experts at Functional Medicine of Idaho. You'll find high-quality supplements to support your health and optimize your body's natural functions. Rooted in responsible sourcing and utmost commitment to purity ensures that you're getting products that are not only effective, but also safe and reliable. Plus, you'll find our own line, Functional Medicine Foundations, which is carefully formulated using the best ingredients available so you can trust that you're giving the body the support it needs. Visit FunMedShop.com today and take the next step in your health journey. That's funmedshop.com. So intriguing. So what are let's talk through some of the most common symptoms we see as T levels start to decline in our male population.
So that's the bummer, is that not every guy has the same T that corresponds to the same level of symptomatology. It'd be so much easier if, like with an asthmatic, when we measure their spirometer to see how bad their breathing is, getting air out of their lung, we kind of know how bad off they are. There's a cutoff. With some guys at 400 or even 300, 200, low levels, they feel great.
Yeah, it's interesting.
It's insane. And then there's some guys at 600-800 who we decide, it's a risk benefit decision. Let's do a trial, see how you feel.
Right.
And they're gaining more muscle mass. They've got better focus, stamina, endurance, shorter recovery times.
Better sleep.
Better sleep is huge. This is one we hear all the time.
Yeah, all the time.
Right. And they were at a dose where no one would ever have put them on anything.
Right.
So it really brings home the point that there is really no normal level for which, if somebody's having symptoms, it's not maybe worth trying a short trial.
Yeah.
And that's true with men and for women.
How about guys with depression?
So that's a great question, because so many of the depressive symptoms mimic low T.
Yeah.
And in fact, it's not an SSRI deficiency, an antidepressant. It's a T problem.
Yeah.
And so many wives come to me afterwards and thank me, saying he's less irritable, he's less grouchy. There's this stigma about if you put guys on T, they become jerks and, are aggressive and roid rage and, cutting people off and giving them the salute on the road. I see that mostly with guys that are really overdosing on illegal anabolic androgenic stuff that they get out of their buddy's trunk at the gym parking lot, and these guys are destroying their liver, they're causing cancers, they're suppressing their hypothalamic pituitary gonadal axis, sometimes for life.
Yeah.
And they're jerks. You can spot them in the gym. You can see who's juiced. They look like a tomato. They're like they've been bearing down. They got a red complexion, and they're just kind of angry and strutting. Versus guys that they look great and they're normal. those guys on the synthetics don't have any natural metabolites, or I should say no natural enzymes that can handle those synthetic products.
Right.
So they just build up in their system. And that's why they behave that way. You can do the same thing if you overdose with bioidentical natural stuff too. So there is a sweet spot. But symptoms typically are low sex drive. That's probably one of the most common.
Yeah.
Guys, this is one we have to ask about because they're like, oh, yeah, that doesn't happen anymore. Spontaneous AM erections.
Yeah.
That's probably the most sensitive question that you can ask statistically, that's going to identify a guy that's got an issue.
Yeah.
It's hit and miss on erection issues. Testo is not first line for treating erectile dysfunction. There's only about a 19% prevalence of low T with guys that have ED.
19.
And yet it's one of the things that brings a lot of them in.
Yeah, absolutely.
And then they find out, oh, I need Viagra or I
Right.
need nitric oxide support because they've got vascular disease.
Yep.
So then that opens up the conversation to say, hey, it's a bummer that you got ED and you can't get things to last as long as you need. But I'm now concerned about the fact that grandpa died of a heart attack at MI. You're 50
Right.
and you've got signs of low vascular NO, nitric oxide. That's not just a problem in the bedroom. That's a problem with,
Cardiovascular
developing
health.
vascular disease.
Yeah.
Yeah. So symptoms really vary by number. You just have to treat the guy as an N of one, a personal approach.
Okay.
But yeah, you'll see anything from, those are the more specific, low T,
Right.
Decreased interest, decreased drive, depressive symptoms. The ones that are a little more generic, that are harder to pinpoint to low T, are things like fatigue,
Okay. Yeah.
poor sleep.
Yeah. Because that's so multifactorial. There's
so
multiple causes
yes.
to that. Yeah.
Not able to build muscle in the gym, putting in the time. That's
Yeah.
another one
Yeah.
that's I hear a lot.
Body composition, just in general, right?
Yes.
Men and women.
Yes.
Just poor body composition. What worked 5 years ago is just not working anymore.
Yeah, exactly. Really delayed recovery. It takes them a long time to recover from an effort of exercise.
Yeah.
And, this is not just for bodybuilders that want to work out every day insanely hard,
Right.
which we discourage because we want good recovery a day or two a week. It's for the average, weekend warrior and somebody who's out there 3 days a week going to the gym. It can really speed up recovery.
Yeah.
So the results, especially if you're using peptides in conjunction, can be just logarithmic.
Peptides. Like what kind of peptides would we want to use in conjunction with testosterone? Besides
So-
the GLP-1s, we talked a little bit about some of the microdosing these GLP-1s, but I know there's other
Yes.
great peptides out there
Yeah.
that our guys love.
Yes. The GLP-1s are, your guys that have that belly fat, that have got fatty liver, really metabolically unhealthy, I always say, hey, how much weight, what's your goal? Even though I don't care about weight and BMI, I'm looking at comp.
But they care.
They care.
They do, yeah.
And they do.
Yeah.
And they usually have a number. I'm 285. Okay. How tall are you? 6'2". Okay. Where do you want to be? I think 225, 230. Let's be realistic. And, we'll do the body composition. We'll look at that instead of their scale, because that could be so deceiving. Yeah. But I think focusing on the body composition as opposed to weight loss, focusing on, hey, what is this particular hormone doing in concert with the symphony of all these others?
Right.
For your liver, your thyroid, your glucose management, your mood, your neurotransmitters, and we'll look at probably weight is I'm going to say the low hanging fruit.
Okay.
Exercise number 2, both lifting and aerobic, both resistance training and aerobic
You
work.
need to do both.
You kind of need to do both. A lot of guys are just focused on resistance training only. When you do your cardio, it's, I think, better use of your time to do high intensity interval training.
Okay.
So 20 minutes, 2-3 times a week, you can do some butt kicking intervals.
Yep.
This whole thing of slogging away on a Nordic track or a stair stepper.
Did you say Nordic track?
I did. That dates me, huh?
That does date
No
you.
one knows what that is
No, but
anymore.
I don't think they don't make them anymore.
Because they don't make anymore. But it's because they're just clothes hangers. That's all they became used for.
Nordic track.
Whether it's a Peloton.
There you go. There he is.
I can't remember. I believe I remembered NordiTrack, but yeah, these instruments of aerobic forever.
Fancy new treadmills and Pelotons where you're hitting it hard. Or I shouldn't say hitting it, but you said slogging away 60
an hour
90
on
minutes.
that.
Yeah.
You know, you go to the gym and you watch these folks hanging onto the handles.
Yes. Yeah.
Their feet
They're
are at
on
the
their
back
phone,
of the belt
just
on
not
the
even-
treadmill.
Yeah.
But they're watching their show.
Yeah.
And they've been on there for an hour and a half.
Yeah.
At 80% of their,
Yeah.
that's a lot of oxidative stress and really not going to get you very far.
Hard on your cortisol, hard on your thyroid, which, as we just talked about, is kryptonite to tea. So not really helping you.
So we want both types of exercise. I think diet is a huge factor. Everyone always wants to know, what's the prostate friendly, what's the testosterone friendly diet? Well, it's organic, it's whole grains, it's whole foods.
Omega-3s.
It's not necessarily carnivore.
Yeah.
It's not necessarily long-term ketogenic. It's omega-3s. It's plants. It's great sources of lean, clean protein. And, not a huge fan of dairy for my guys because of prostate data. But I'd rather them do that than ultra-processed foods. What is the biggest killer? It's sugar. Because we know that arrow goes both ways. Giving testo can optimize diabetes, but if you've got high sugar and really you're spiking your insulin with your Lucky Charms, your Cheerios, and your Chip Ahoy cookies, and you know what that is, right?
Yes, that didn't date you. I think, do they still make
Right.
Chip Ahoy? Do they? Okay.
I think they.
Our producer says
they
yes.
Do. Our producer says yes, so we'll go with it.
Yes. Okay.
So those things are going to spike your sugar. And they probably do a number on your T level.
Yeah, for sure.
So that goes both ways. So we're going to address diet.
Yep.
So what's that? That's weight, that's exercise, that's diet. Manage stress.
Yeah, sleep and stress.
Cortisol is kryptonite, I always say to my guys.
Yeah.
And if you're stressed out, you're not going to want to have sex. You're not going to make tea. Your body's trying to survive. And I don't care if you're 25 or 65, it takes away all of those normal functions. And until you deal with that, giving testosterone is kind of like going out here in the parking lot and flooring my car while I have my other foot on the brake.
Yeah.
And
So that's a hard one for guys. And maybe I'm wrong because I'm not a guy, but I live with a manly man and I'm raising 2 little men. But I feel like there's a lot of talk in our society about self-care for women and stress management for women. It is a hot topic, right?
yeah.
But I don't think the guys talk about that. I don't think that's a thing for men, right? These men that are, raising their families and they're sole providers or main providers for their family. And my husband doesn't have me time. Like I think he'd laugh at that, right?
Yeah.
So how do you encourage your guys to manage their stress and manage their cortisol levels? What does that look like?
Having been at this a long time, guys have come a long way in that arena. Traditionally, historically, that has totally been true. In the last 10 years, even, most of it being here in Idaho, have seen a turnaround.
Good.
There are more men being proactive, probably because their wives are telling them and significant others to get their butt in there and fix what's wrong with you. Because
Totally.
you're 35 and you don't have any libido and I'm driving all this initiation. Something's wrong here.
Yeah.
So some of it's that.
Okay.
Some of it's fear of medical, disease, diabetes, and all these fatty liver things. I think guys are not very good at networking. We're kind of used to being an island.
Right.
And we just suck it up. And we don't talk and communicate like women do.
Yeah, you guys don't. You don't engage in community like that. But that's also not how God made you. I get that. You're not the same.
Yeah,
but you need that.
We need that. And I think where it's important in today's culture, and this gets a little beyond tea, but I'm going to share my spiritual look at life, and that is guys need accountability.
Yeah.
Men need to be trained and to watch by example what does a man do? What does a man look like? What is a good father? Mm-hmm. And if they don't have that in their friend group or their own father, their father-in-laws, it's really tough for them to know how to behave, especially in this culture where, there's a lot of demasculinizing going on. And, it's almost like you got to apologize if you're a male. Shame on you for being born with this thing hanging between your legs because you are subpar and you have testosterone poisoning. Therefore, you need to be apologized. BS. Let's get real. There's folks that are, divinely dedicating themselves and following a plan of action. Whether that's God, for me, that's God.
Yeah.
Whether that's someone else's tradition, find out why you're here, the bigger reason, and the context of what it means to be a fully functioning male, I think will be made clear to you. It will be revealed to you. So it's so much more than just 4 rings of carbon stuck together, testosterone, steroid, hormones. There's a spirituality about what it means to be male and to be a healthy male,
right,
not a compromised male where the poor female other half is just has another kid on their hands, as opposed to a helper.
Thank you for listening to the Functional Medicine Foundation's podcast. For more information on topics covered today, specialties available at the FMI Center for Optimal Health, and the highest quality of supplements and more, go to funmedfoundations.com.